So thank you for having me. Starting about 6 months ago, I started to have pretty severe vision degradation in my right eye. And it got to the point where with my left eye I could see just fine, 20/20 better than 20/20, but with my right eye, I really couldn't see anything. I couldn't see words, couldn't see letters. And the good news is I have great health insurance and I have money and I can afford to go see great providers and I'm getting treated and that's wonderful. So I tell you that story. It seems like a bad story, but one of the interesting things is that there was a strange upside to having one type of sight out of one eye and another out of my right eye. In my left eye, I saw the world as everybody else sees it, normal, everybody wearing suits, you all look lovely. But in my right eye, if I actually look at you right now, it kind of looks like a Monet painting. Things blur. And so I tell you that story, not because I'm trying to disclose HIPAA information here, but what it really does, it kind of forced me to think more about perspective than I ever had in my life. And in everything that I do, I started to think about how had I seen the world traditionally, and how, if I put a different lens on, might the world look different. And so it specifically got me thinking about my job and my role and the industry that I'm in. I work in healthcare. And what I'd heard is that the American healthcare system is broken. But it got me wondering, what if we've got it wrong? What if we got it wrong? And what I heard was, look, it's broken, this doesn't work and that doesn't work. Patients, consumers are just awful. If consumers weren't so stupid and so lazy and they just started doing the right things, all would get better. And about providers and physicians and health systems, if only they weren't so inefficient and ineffective and expensive, things would get better. And for the payers and the insurers, if they weren't so interested in managing profit that they actually started to manage care, things would get better. And the product manufacturers, particularly pharma, if they weren't so just darn greedy, things would get better. And that's what I heard, and that's what I believed. So if I look to the world in my left eye, what I see is the same thing that everybody else saw, was a system that was broken. But as I started to think about things from a right eye perspective, it got me asking, what if the system isn't broken? What if the system is actually working perfectly based on what it was designed to do? What if the issue is that the design principles that we've used to develop the system and continue to develop the system are wrong? What if we change the design principles? Would things get better? So, what is the design paradigm that defines healthcare today? It's what I actually call the balanced interest paradigm. And it goes something like this, that there are a bunch of different players. There are payers and providers, product manufacturers, and the patients. And if we develop solutions that ensure that all their interests are aligned and that ensure that all their needs are addressed, the system will work better. And I'm here to tell you today, I think that if you believe that is the correct paradigm, you got it all wrong. That the real paradigm should be, I know we have one other recent Walmart associate in the room here, but there's a cheer that we do at Walmart before large meetings and after large meetings and in all the stores that our associates do. And the last line of the cheer goes something like this. The person who calls out says, "Who's number one?" And the response from the crowd is, "The customer always, huh." Well, that's what I think the paradigm for healthcare should be, the customer always. What if we designed the system to be 100% about the consumer? And we basically said all the other players there have one purpose, to serve the interests of the consumer. If we did that, what would the system look like? So I'm going to give you my view of what I think a consumer-driven system would look like. The first change in a consumer-centered health system would be digital health would explode, and it would not be impeded by regulations or by medical boards. And what I mean by digital health, I don't mean telehealth. I think something more innovative. It's the use of technology and the ability of consumers to engage with technology directly to get the care they need. without having to engage with providers or professionals. And you're already seeing groups who are starting to innovate in this space. So certainly I look at a company like Health Partners in Minnesota and their Virtual platform, or startups like Lemonade or Zipnosis. I think about a world, take the Amazon Echo product and the Alexa platform, where today, when you talk to Alexa, she can help you create a shopping list, or if you've watched the recent ads, turn on sprinklers. But what if Alexa could actually, in your engagement with her, could help assess, diagnose, and treat you without you ever having to engage with a provider? I'll give you a real-world example that we see today in our stores. We have a relationship with Pursuant Health, previously known as Solo Health. They have health risk assessment kiosks in our stores. And actually, an interesting fact, they're not in all of our stores. They're actually in less than half of our stores. And if you can go in some of our stores that have them, they're not always in the easiest place to find. They're sometimes in the darkest corner of the pharmacy. But even with that, in a week, on those devices, there are more health risk assessments done of U.S. consumers than are done in the entire U.S. traditional healthcare system. And so you look at the ability to engage consumers in health, I think digital health is an obvious way to do it. The second change I think you would see is that today many services are currently restricted or hidden behind physicians, that those services would become unlocked and that the system would be designed around trusting consumers. And I'll give you an example there. Lab and diagnostics would be one that I think would become front and center, would become ubiquitous and democratized. Why do I have to go to the doctor's office to figure out whether I have flu? Why do I have to go to the doctor's office to figure out what my cholesterol level is? We have every quarter something we call Walmart Wellness Day, which is an event where for 4 hours on a Saturday, we do free health screenings. So we do blood pressure and glucose and sometimes cholesterol. And what's interesting, in a 4-hour period, in the last one we did, we provide screenings for around 300,000 people in the U.S. And what we saw were consumers, half of which have not had a glucose test or have not had a cholesterol test ever before, who took that information and actually went out and did something about it. They went out and sought out a physician if they thought there was an issue. And so this sense that if you could unlock some of the power of these things that we've hidden behind closed doors and allowed consumers to engage directly, you'd see enormous change. And the good news is we're seeing companies who are developing solutions that I think are going to enable us. Companies like Now Diagnostics, Q, and 23andMe. The third change is the reality is that the physician is not going to be the center of healthcare. That particularly patient-centered medical homes as you know it won't exist or shouldn't exist in that consumer-centered space. That instead the system would organize around the individual, not the individual organizing around the system. I think it was mentioned in an earlier talk, you would see wildly different delivery models. And the key providers wouldn't be the physicians. They would be what we like to call PNPs, which stand for professionally nice people, whose job is to do one thing, listen and support. And so we've seen models, certainly Dr. Paul Farmer and Dr. Jim Kim with Partners in Health and the work they've done in Haiti and Peru and Rwanda, or Dr. Sonia Shin in the Navajo Reservation, New Mexico, in their use of community health workers. We wonder, why won't that work? If that's working in all those places, why can't it work here? And we've seen other industries that have undergone rapid delivery model change driven by their need to be more consumer focused, and wonder why we can't do that in healthcare. And I'll give you an example, two examples. One is in auto care, where over the last 30 years, the average vehicle in the U.S. is able to stay on the road twice as long as it used to be. And it's because of a number of things, but one of them is because of ubiquitous access to preventative care services for your car. So Jiffy Lube, Valvoline, these services that never exist, where they ripped them out of the dealer and made it easier to access. Now you're seeing people changing their oil more often, rotating their tires. That has fundamentally transformed and extended the life of vehicles. In banking, my first tax-paying job was as a teller. I have not been to a teller in 5 years. I do all my banking online and by mobile phone. I use ATMs, and I use call centers when I have a specific need. And so as an example of a new approach that we've seen that's actually quite interesting is around dental and oral care, where everybody wants to, there's a lot of interest, particularly around groups playing in Medicaid, where there's a desire we need to get more access to oral care in rural markets and in underserved markets, and so let's put a dentist everywhere. Except that doesn't work. That doesn't scale. There aren't enough dentists. Instead, we've seen a model that we call, it's a spoke and hub model. And the spoke is putting in very small centers that do nothing more than just preventative care, oral care, teeth cleanings. And you do it with just a single individual who can clean teeth. And then if there's more advanced needs that come from that interaction, they get pushed to the hub. And then at hub, you have multiple dentists who all they do is higher level care. And so we look at that model and say, why can't that be pushed into more, across the entire healthcare sector? One final change is the emergence of advanced analytics, but using non-healthcare data. And I was just in DC a few weeks ago with my kids, and it was the first time that my boys who were 9/11 that had ever been here. And during one of the visits to one of the museums, we learned an interesting fact that in the world as we know it, 5% of the stuff is traditional stuff, the atoms, and it's what you can see. But 95% of it is dark matter and dark energy, stuff that we know very little about and haven't begun to comprehend. I think that actually is the reality in the US from a data perspective. We're making all of our decisions based on clinical EMR data and claims data, and that's the 5%. And the dark matter and the dark energy is all the behavioral data that we create all the time on social media and in stores. And so we think there's an enormous opportunity to start to think about analytics in a new way of leveraging all that behavioral data to assess and predict health. And there's two examples that are, one kind of better known, one less known. But Target a few years ago, you may remember, got in trouble because they were able to use their data to predict women who were pregnant. In most cases before they knew they were pregnant. And then where they got in trouble was they decided that we'll market to those women before they knew they were pregnant, and they weren't very happy. But what it showed was the power to actually use a basic level of analytics and predict something that someone didn't even know was happening. More recently, Microsoft in June announced, they have researchers that announced that through the analyzing of search engine queries, they can predict cancer, particularly prostate cancer, before there was actually a clinical diagnosis for that individual. I believe there's enormous power there. So those are four of the ways, those aren't the only ways, but those are four of the ways that I think the healthcare system in the US would transform if we were truly consumer-centered. And at Walmart, these are the design principles. This is the design principle that we're using, a consumer-centered design. And I want to make one quick comment on quality, since this is a conference around quality. Obviously, I think we'd all agree that the system isn't as high quality as it should be. And I believe poor design principles help to explain that. And I'll use an example that hits close to home. My wife, who's much smarter than me, and certainly is actually more qualified to do the job that I'm in than I am, she founded a company called Baby & Company. And what Baby & Company does, they operate standalone labor and delivery maternity centers across the US. And in one of the markets, I won't pick on this hospital, I have done it in the past before, but I won't name their name. I'll just say that in one of her locations, there's a hospital that's about a half a mile away. And in her facility, her C-section rate is somewhere between 5% and 8%. And in this hospital, it's almost 40%. And if you think it's because, well, they are seeing higher risk patients, actually no. The risks are roughly the same. So the way the hospital explains it to employers in the market is, well, that's what the women want. They're choosing to have C-sections. So we actually surveyed women who had had C-sections, and we said, why did you get a C-section? Not 100%, but almost 100% said they did it because that's what the physicians told them to do. And I'd ask you if we were really, truly interested in if we had a consumer-centered system, I can kindly tell you we wouldn't be having those kinds of results. And I can tell you that you wouldn't have women being forced to have a procedure that creates a health risk for them and a risk for their baby. So my challenge, and I'll go back, is, I'll look through my right eye and tell you, change your perspective. Imagine how the system might work if we truly design things around the needs of the consumer. And if I'm right, the winners will be those who are able to do that. And the losers will look a lot like Circuit City, A&P, Borders Books, and Virgin Records. Thank you very much.